this panel, this power panel, represents different specialties, but they are all linked with one common thing. They all practice functional medicine. So that time, you come on down first. Let's talk about functional medicine. A lot of folks don't know what it is. They've never heard the term before. Please, folks, I want you to remember what this means from now on. Talk to us about how this is different from the traditional practice of medicine, where all of us got our training, but maybe need to move away from.
Yeah, it's a fundamentally new way of thinking about health and disease. You know, there's two ways of thinking. In conventional medicine, you're either sick or you're healthy.
The most of you think this, right? How you doing? I'm fine, or I'm sick.
Right. But in functional medicine, we don't think that way. We think about the continuum of health, from optimal health on one end, all the way to hidden imbalances to full-blown disease. And like you go from optimal health to weight gain, high blood pressure, cholesterol, diabetes, and so forth. You know, what we want to do is all along the way, we want to intervene to deal with the root causes and reverse the process. You know, disease goes away as a side effect of getting healthy. Yeah, and we treat the whole system, not the symptoms. And food is our most powerful drug.
So take this idea right now. You've mentioned a few things here, and let's talk about diabetes, which happens to be a place that you are a world expert, a real authority. Talk to me a little bit about how we have missed the boat in your traditional practice of medicine when we try to take care of diabetes.
So traditional docs think of obesity and diabetes as two separate problems, but it really should be called diabesity, which is the idea that obesity and diabetes are really the same disease. They're so interconnected, and they're the main drivers of heart attacks, strokes, cancer, dementia, and more. Now, conventional docs wait until you have diabetes. They don't treat you along the continuum. They give you medication. That's just wrong.
Now, you had a revolutionary plan to treat, we'll call it diabetes. I love that term. And usually there are two tests that doctors have to be able to do. Two things that all of us getting cared for, whether you have pre-diabetes or diabetes, that's a third of the population, so there's a lot of us, have to know about. And most physicians do not know about these tests. So
they don't do them.
Yeah. So they can't do them.
So the first one is called the insulin response test. You see, most doctors just check your blood sugar, but that's a poor indicator of diabetes. The first thing to go up is your insulin, and that's a fat storage hormone. That's what you should be checking, and it's what causes belly fat and inflammation.
All right, so the first is an insulin test, which your doctor can get for you if you ask him for it. And the second test?
It's called an NMR cholesterol test, and it measures the particles you have of cholesterol and the size. See, most doctors just check the weight. That's your total cholesterol number.
Now, what Dr. Hyman is saying is that if we think about our blood vessels as this container here, right? There's the blood vessels. What keeps the cholesterol in our blood and not inside the wall of the arteries where it can cause damage is this thin little layer of cells. So it's called the endothelium, but it looks like a net like this. So if you take a big particle of cholesterol and you throw it in there, it can't get past you. In fact, a lot of times it'll bounce off. It's not going anywhere.
There, look at that.
Now, the problem is, you're not a good shot. The problem is...
You want it to bounce off. That's good.
So, if you have small little particles, these big fluffy things aren't going to do you much harm. But the small particles, they're like sharp little bits of glass shard, right? They will pour past those ones, going through the lining of the arteries into the artery itself, which can cause plaque, damage, the kinds of problems that we talk about leading to heart attacks, strokes, all kinds of other headaches. Doctors don't test this. We never had the ability to test this until recently. So imagine an MRI scan taking a picture of your cholesterol and telling you exactly the size of it. This is a much more valuable tool for us. So before you run off and start taking medications for cholesterol number that may or may not be a problem for you, you want to know what that cholesterol size is. Does that make sense, everybody? All right. Now, you say we also get it wrong when it comes to fighting diabetes. Where did we miss the boat here?
We have to deal with the causes, and the main cause is inflammation, which causes diabetes. Okay. And besides sugar and flour, food sensitivities, hidden food sensitivities can cause inflammation. So there are things you commonly eat that you think are okay. For example, like dairy, or wheat, or corn, or eggs, or soy. All these things may cause inflammation. So how do you know if you have a problem? Well, you stop them for 2 weeks.
Each one individual?
No, all together. Okay. And then you add back one at a time, a couple of days apart. And if you gain weight or you feel bloated the day after, you're probably sensitive because it's causing inflammation.
Got it.
It's powerful. And the other thing I love with my patients is this super fiber. It's called PGX, and it's made up of a Japanese root and seaweed. And if you look at this, a spoon is standing up in this,
oh my goodness,
which is it turns to a gel. So when you drink it in a glass of water right away, you can drink it. But after you leave it there, it turns to this gel, and that absorbs fat and sugar in your gut and prevents these spikes in insulin, which lowers your levels of insulin, which lowers the fat storage hormone, which prevents belly fat and inflammation, curbs cravings, and makes you lose weight.
This looks tasty.
It doesn't taste like anything, actually. It's completely tasteless, and it's also great for your bacteria in your gut, all sorts of wonderful things.
And just to be clear, my wife actually takes this stuff, and you eat it before it looks like this.
Yeah, you drink it, it's not so water, right?
In your stomach, it looks like this. A few minutes later, when you take it, it's actually much more important.
Very
It's like
powerful.
quinoa, actually.
Yeah.
Thank you very much.
Thanks.
I appreciate it.
Dr.
But anyway, Susan Guam, come join us. She's going to talk to us about exhaustion and the topic that so many of you reach out to us to talk about. And let me ask you, if I send a patient to you, talk to me about how the experience would be different from if they went to a conventional practitioner looking at why they're tired in life.
Well, for me, I have a long checklist that I go through to see why somebody might be tired. I look at foundational systems instead of just looking for a disease, right? So when you go to a traditional doctor, they're actually looking for a disease to label you with so that they know what to treat you with.
So if I said, okay, I'm exhausted, I have no way.
This is a live Super Doppler HD update from KCCI News Channel 8 HD.
Hi, everybody. Meteorologist Joe McLaughlin. You're looking at live Super Doppler HD as a severe thunderstorm rolls across central Iowa. We've seen some very extreme wind gusts from this line of weather as it has moved across. Now, just about all of the Des Moines area getting ready to push over toward Altoona as we move the laps. Wind accelerating out ahead of this system and gusting to around 65 to 70 miles per hour. We did have a gust here at the KCCI studios at 66 miles per hour at about 2 minutes after 4 o'clock. You can see other areas that have been affected by this also seeing extreme wind gusts of 40 to 50 miles an hour. And there is likely going to be reports of minor structural damage here in the central Iowa area as this line of weather moves across. Again, as this leading edge of the storm pushes across your area, we're getting the strong outflow winds.